Imagine this. You're sitting at the kitchen table trying to remember something simple. A name, a word. Why you walked into the room. It slips away. And for a moment, you wonder, is this normal aging or something more? Now here's something most people don't realize. Changes in the brain don't start when symptoms appear. Research shows that the process behind conditions like dementia can begin years, even decades, before the first noticeable signs. But here's the important part. That doesn't mean there's nothing you can do, and it definitely doesn't mean you should panic. Because understanding how the brain changes over time is one of the most powerful ways to protect your independence, your memory, and your quality of life. Today, I'm going to walk you through something very important. We'll talk about how cognitive decline is commonly described in medicine, using a structured model that helps doctors and caregivers understand what's happening. But more importantly, I'll explain it in a way that is clear, calm, and useful, so you can recognize early signs, reduce fear, and focus on what actually helps. Before we begin, one very important note. The information in this video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. If you or your loved one have concerns about memory or cognitive changes, please consult a qualified healthcare professional. Now, let's take a deep breath and approach this step by step. Because this topic is often misunderstood. Many people think of dementia as something that suddenly appears, but in reality, it's a gradual process, and it doesn't follow a perfectly straight line. Symptoms can overlap. Some days are better than others, and every person's experience is different. Doctors often use something called the Global Deterioration Scale, or GDS. This model describes our 7 general stages of cognitive change, from normal function to severe decline. But remember, these stages are not rigid boxes. They are simply a guide. Stage 1. No noticeable changes. At this stage, there are no symptoms. Memory, thinking, daily function all appear completely normal, and this is where most people are. Even though subtle biological changes may begin in the brain with age, they do not affect daily life. There is nothing to diagnose here, nothing to treat, just normal living. Stage 2. Very mild changes. Now we move into something many people experience: occasional forgetfulness, misplacing keys, forgetting a name, then remembering it later. This is often called age-related memory change. And in most cases, it is still considered normal aging, not dementia. You can still manage your finances, live independently, hold conversations, stay socially active. This stage can feel frustrating, but it is very common and usually not dangerous. Stage 3. Mild cognitive changes. This is where things become more noticeable, not severe, but noticeable. You might forget recently read information, struggle to find the right words, lose track of conversations, get confused in unfamiliar places, and importantly, other people may begin to notice. At this stage, doctors may use the term mild cognitive impairment, MCI. Now here's something important and reassuring. Not everyone with MCI develops dementia. Some people stay stable for years, some even improve with lifestyle changes. This is a critical window where action matters most. Stage 4. Early dementia. At this point, changes become clearer. Tasks that require planning and organization start to feel difficult. For example, managing bills, planning trips, following complex instructions. You may also notice difficulty remembering recent events, reduced awareness of current news, withdrawal from challenging situations. Some people try to hide these changes. Others may not fully recognize them. This stage often leads to a formal medical evaluation. And again, This is where support and early intervention are very important. Let's continue. Stage 5. Moderate cognitive decline. At this stage, daily life becomes more challenging. A person may begin to need regular assistance. For example, difficulty remembering their address or phone number, confusion about the date, season, or time, trouble choosing appropriate clothing. However, they usually still recognize close family members, eat independently, use the bathroom without assistance. This stage is often when families step in more actively, and emotionally, this can be a difficult transition, not just for the person experiencing it, but for loved ones as well. That's why patience and calm communication become essential. Stage 6. Moderately severe decline. Now we move into a stage where support is needed almost constantly. Memory becomes more limited. A person may forget names of close family members, experience confusion about surroundings, have difficulty recognizing familiar faces. There may also be changes in personality, increased anxiety or agitation, sleep disturbances, repetitive behaviors. Some individuals may develop suspicion or fear, emotional outbursts, and in some cases, physical symptoms appear. Difficulty with toileting, reduced ability to perform basic daily tasks. At this point, care becomes more intensive, and caregivers must focus not only on safety, but also on preserving dignity and comfort. Stage 7. Severe cognitive decline. This is the most advanced stage. At this point, the brain can no longer support basic functions independently. A person may lose the ability to speak clearly, require full assistance with eating and movement, become unable to walk or sit without support. However, and this is very important, even in this stage, people can still respond to a gentle voice, familiar music, human touch. There is still connection, even when words are gone. Care at this stage focuses entirely on comfort, safety, compassion. What you need to remember. Now let's pause for a moment, because I want you to walk away with clarity, not fear. Here are the key truths. These stages are minor, not exact timelines. People can move differently through them. Some symptoms overlap. Early stages can remain stable for years, and most importantly, not every memory issue means dementia. Reassurance, what actually helps protect your brain. Instead of fear, focus on what is proven to help. 1. Physical activity. Regular movement improves blood flow to the brain. Even simple daily walking makes a difference. 2. Mental stimulation. Reading, learning, puzzles, conversations. Your brain needs challenge to stay sharp. 3. Social connection. Isolation accelerates decline. Connection protects cognitive health. 4. Sleep quality. Poor sleep is strongly linked to memory problems. Your brain clears waste during deep sleep. 5. Managing health conditions. Blood pressure, diabetes, and heart health all directly affect brain function. A final thought. If you're watching this and feeling concerned, take a breath. Awareness is not something to fear. It's something that gives you control. Because the earlier you understand how your brain works, the more you can do to protect it. And if this message helped you even a little, share it with someone who might need it. Because sometimes, the right information at the right time can change everything.